morning, afternoon, or evening, depending on where you're joining us from today. But thank you for joining us for our presentation, New Edition Trusted Mission Instructor Guidelines for the 9th edition of NRP. My name is Dr. Bobby Byrne, and I'm the co-chair of the NRP Steering Committee, as well as a neonatologist in Indianapolis, Indiana. Before we get started, I wanted to let you know how to submit questions to our other two amazing panelists who I'll introduce shortly. Next slide, please. We will not be using the chat function today. Rather, we will use the Q&A feature on the right corner of your screen. Click the question mark, type your question, and then hit enter to send to our panelists. If a panelist types in an answer, the question and answer will appear on the screen for everyone to see. If you want to only see your questions, go to the top of the Q&A panel and click on My Q&A. If you have an urgent IT question, type that into the Q&A as well, and an NRP staff member will respond. Any questions not answered during the webinar will be answered and posted with this video in the Instructor Toolkit. It is my honor today to introduce today's speakers who will share information specifically for instructors to help with the transition to the new NRP, 9th edition. We will focus on instructor support, curriculum and website improvements, new materials, key dates, and transitional information. So our panelists. First, we have Dr. Gary Weiner. Gary is a clinical professor of pediatrics at the University of Michigan Medical School. Gary has been instrumental in editing the textbook of neonatal resuscitation all the way back to the 5th edition through the 9th editions, serving as lead editor for the 7th, 8th, and 9th editions. Gary also serves as the vice chair of the ILCOR Neonatal Task Force. Welcome, Dr. Weiner. Dr. Chris Cooper is a neonatal nurse practitioner for regional neonatology at Seattle Children's Hospital. Chris is an associate editor of the textbook, works with the Instructor Development Subcommittee of the NRP Steering Committee, and serves as the nurse consultant to the NRP. Welcome, Dr. Cooper. And just a quick word of thanks to both of you and the AAP staff, not only for taking time today to be here, but for the hundreds, if not thousands, of hours you've put into the 9th edition of the NRP textbook. Next slide, please. This year, for the first time, the Pediatric and Neonatal Guidelines for Cardiopulmonary Resuscitation and Emergency Cardiovascular Care, so CPR and ECC, have been developed as a true 50-50 partnership between the American Academy of Pediatrics and the American Heart Association. This year, the Pediatric Advanced Life Support, Pediatric Basic Life Support, and Neonatal Life Support chapters were each led by two co-chairs, one from the AHA and one from the AAP. Just as importantly, the writing groups themselves were balanced, 50% AHA members and 50% AAP members. That means these guidelines don't just carry one organization's stamp. They reflect the combined expertise, commitment, and vision of both the AHA and the AAP. We're especially excited that these guidelines have been jointly published in Circulation, the AHA's flagship journal, and in Pediatrics, the Journal of the American Academy of Pediatrics. In fact, the title itself reads, The AHA and AAP Guidelines for CPR and ECC. This represents more than a new set of recommendations. It represents our shared commitment to advancing pediatric and neonatal resuscitation together. The guidelines were developed by ILCOR, the International Liaison Committee on Resuscitation. This group of experts from around the world, including AHA representatives from North America, rigorously reviews the latest science. Through that review process, they produce the Consensus on Science with Treatment Recommendations, or COSTARS. They focus on everything, identifying what the evidence truly supports, where gaps remain, and where clinical practice needs to evolve. That work is the foundation for everything we teach in NRP, NRP isn't based on tradition or opinion, but rather science. From there, the AHA and the AAP take the co-stars and translate it into guidelines that fit real-world practice in the U.S. Multidisciplinary writing groups interpret the science and apply it to the situations you face every day: EMS calls, hospital codes, and neonatal resuscitations. Every 5 years, that work becomes the guidelines for CPR and ECC, recommendations that are clear, evidence-based, and actionable. The final step to make sure those guidelines don't just stay on paper, but rather are embedded into educational programs like PALS and NRP. These courses are how you, as instructors and clinicians, carry that science into classrooms, simulations, and ultimately to the bedside, so that global evidence becomes local action, and you're the ones who make that transformation happen. One of the greatest strengths of the NRP leadership is the diversity of our steering committee. I am so honored to be a part of this multidisciplinary group representing neonatologists, nurses, midwives, respiratory therapists, simulation experts, educators, and more. We come from both academic and community practice settings. That diversity is very intentional. It ensures every decision we make reflects the real-world needs of learners and newborns in every type of care environment, not just one type of system. Gary, thanks for being here. I think you're going to lead off with some science changes.
Yeah, thanks, Bobby. So in yesterday's presentation, we primarily discussed the main science changes for the 9th edition NRP. And for those of you who couldn't attend yesterday's presentation, you can find it posted on the AAP NRP website and also in the instructor toolkit. Today's presentation is primarily going to focus on how you as an instructor can gain a deeper understanding of the curriculum changes, the resource changes for the 9th edition NRP, operational changes for learners, instructors, and instructor candidates, and also how you can disseminate the information to your learners. In just a moment, we'll briefly review some of the science changes that we talked about yesterday. But again, today's focus is really going to be on things you need to know as an instructor. Next slide. So in tiny print here is the practice change table. And one of the first things I expect you'll be searching for is this document, the practice change table. And it summarizes the main changes in the 9th edition NRP directly compared on the adjacent column to what we recommended in 8th edition. And you'll see there's frankly not really a lot of science changes or practice changes. It's really pretty consistent with 8th edition with some minor tweaks. The table here, the practice change table, is concise. You can print it for easy reference, and you can find this practice change table on the instructor toolkit under the Home tab. It's also on the AAP NRP homepage link. Later in the presentation, Chris is going to share more about the new tabs and the organization of the instructor toolkit, as well as where to find key information for you and your learners. And I recognize you can't see the table right now very well, but among some of the changes, you'll notice we've added 2 new boxes to the algorithm. One, birth is now in a box because it's an action instead of just placed alongside one of the arrows. And initiate the umbilical cord management plan is a separate box at the top of the algorithm. Those are really the main changes. And if you're somebody who reads the American Heart Association guidelines, American Heart Association AAP guidelines, in addition to the NRP textbook, you'll notice that this time both algorithms, except for maybe minor changes in color, are exactly the same. Some of the other changes that we've made, the oxygen saturation targets for babies under 32 weeks are now broader. So under 32 weeks gestation, the oxygen saturation target is between 30% and 100%. At this point, we're not really certain what the ideal oxygen concentration is for babies under 32 weeks, but there's now 3 different target levels: term babies, babies 32 through 34, and less than 32 weeks. We've made minor changes to the recommended peak inflation pressure. Previously, we said 20 to 25 centimeters of water, and in the 9th edition, it's a single universal starting pressure recommended at 25 centimeters of water with a range for preterm babies and a range for term babies. In addition, we've widened the recommended rate of ventilation from 40 to 60 breaths per minute to now 30 to 60 breaths per minute, and that's based on some evolving evidence that slower respiratory rates may actually be better. There's minor changes in the recommended depth for endotracheal tubes, and we've added some additional information on recommended size tubes for various weights and gestational ages. In the 9th edition as well, we've now changed to recommending that you measure the depth of the tube. Instead of tip to lip, it's tip to gum. So tip to the gum on the anterior maxillary ridge. And those are the major changes. You'll also notice that we've now allowed the supraglottic airway, some people call the laryngeal mask, to be used as a primary airway device. So if you choose to, you can use it instead of face mask ventilation. And then I think probably the last change that's significant for you is we've changed a little bit the approach to the Mr. SOPA steps. When you're evaluating the heart rate, we used to tell you if it wasn't increasing within 15 seconds. And in 9th edition, we've broadened that a little bit to make it a little more practical, 15 to 30 seconds. And the order that you approach the Mr. SOPA steps, you no longer have to follow it in the exact order that it's presented. Providers at the bedside have the opportunity to use their judgment and use the steps that they feel are going to be most helpful without having to follow it exactly in series. And I think if there's anything else on that table, I think those are the major changes. So let's move on. All right. Now you'll see there's a new Science in Service optional course that's available. It's a free course called Science in Service. It's available to all NRP providers and instructors as a complimentary resource to review the science changes in the 9th edition NRP. And you can access this Science in Service course from the NRP Learning Platform. And if you can't remember how to get to your learning platform, it's really simple. NRP Learning Platform, all is one word.com, and that'll take you to your NRP Learning Platform. And that's really your entry spot as an instructor to get all the resources you need. Next slide. And then you can also find links to all the major documents. So all of the updated reviews, including the American Heart Association, American Academy of Pediatrics guidelines, as well as the ILCOR, the International Liaison Committee on Resuscitation, COSTAR documents, so the summary of all the science. And as an instructor, you may be asked additional questions regarding the updated guidelines. And you'll see here all the links if you want a deeper understanding of the consensus on science and the guideline changes that are reflected in the 9th edition textbook. These links can be found in the frequently asked questions section on the AAP NRP website under updates. They're uploaded to the ITK in a link under the Home tab in a section called The Science Behind NRP, and you can follow this QR code.
Okay, thank you, Gary. That was a great summary, and I get to tell you a little bit more about the nuts and bolts going forward. Thank you, everybody, for being here, and thank you for already putting your comments in the sidebar. I'm seeing several procedural questions, and I'm going to try and cover some of those as we go forward. So next slide. One of the first things people ask me is, when do we need to have this done by? Instructors and providers are encouraged to complete the complimentary Science in Service course to review all the science updates. This is a video summary that is interactive and uses adult learning techniques to get you up to date on everything quickly. So I really encourage everybody to do that. You will be required to update your courses that you teach to include the 9th edition materials by June 1st, 2026. Long time away, but this is also the date when institutions are encouraged to have transitioned their clinical practice to the 9th edition recommendations. Please work with your institution to develop an implementation plan for a smooth transition. And so anybody who is underneath you or who is taking courses from you needs to know these smooth transition plans. Use good communication and it'll go the most smoothly for you that you possibly can. Next slide. One of the most common questions I get, or we get the AAP receives, is regarding licenses. If you had an inventory of NRP 8th edition licenses, rest assured your licenses have already seamlessly transitioned to the 9th edition. I've got some more information for people who have already started a course a little bit later in the transition, and we'll watch the questions to see if you have additional information. Okay, next slide. And what is included in your purchase of the NRP 9th edition? I'm seeing some questions about this, so hopefully I can clarify this a little bit. All 9th edition NRP courseware will include access to the textbook of neonatal resuscitation 9th edition ebook. This is new and it's an exciting factor because you will no longer need to say, can I borrow your book? Can I check out a book? Where is it? Where can I find a book? You will get a book. It will be available through your learning platform for 2 years, as long as your NRP provider or instructor status remains active. You can also, if you don't have to re-credential or renew your training at this point, you can also purchase the textbook, the ebook, or the textbook, 9th edition, at aap.org in the shop section in the store. It will also be available on Amazon, on Barnes & Noble. I even saw it on Walmart yesterday. So it's going to be coming available soon. For people who are asking when they're going to get their NRP textbooks, we're going to start shipping the NRP textbooks. Shipping will begin in November. So hang tight. But if you want the ebook, you can get that right away. The optional science and service course is free. It comes along with your book also, and you will see that on your ITK or actually on your online learning platform. Okay, next slide. Oh, one more thing I wanted to say about the ebooks. Don't be misled that you have to buy the ebook chapter by chapter. You can purchase the ebook. I can't see it because it's too little on my slide. I think it's like $69 for the entire book. The book will be hosted on the AAP's website. So just realize that as instructors, you can buy it. You can have it on your phone. You can even, hold it right on your phone and make an icon so you can just even access it with one click. So if you have any questions about that, we'll try and get more information if you have questions about that. Okay, so programmatic updates. Along with the largest coordinated guideline release that I can remember in my career, the AAP's coordinated many simultaneous NRP ancillary materials and releases for you. Okay, take a deep breath because there are a lot of them. Through an extensive partner network, we've coordinated the simultaneous release of all NRP 9th edition resources. First of all, photographs and videos have been updated with the exception of the debriefing videos, which have not been redone. We still have our original debriefing videos up. All photos and videos are now updated with new materials, new equipment, and updated to the 9th edition. You can still access your videos from the text or the e-text with a QR code, and they're also additionally on your ITK under a video section, which I'll show you in just a minute. Ancillary materials such as the NRP wall chart, the code card chart, and a new pocket chart have been developed, all with 9th edition. They are all going to be available to you on the AAP. I think it's called Shop AAP on the AAP website at the store. This new feature of having the ability of an ebook with each provider license is fantastic. Having this automatic access to the new 9th edition materials makes it easy for you to review the 9th edition materials. And like I said, if you don't want to wait until you need to renew, you can purchase the textbooks or e-books directly from the AAP store. Science and service is free to you, and I encourage everybody to get onto your ITK and look at that science and service course immediately. or immediately, you know, as soon as you get to it. You can do that as soon as you want. The ITK, your instructor toolkit, has been re-engineered and made more easy to use for you, more intuitive and more easy to use. I'm going to show you the tabs in just a little bit. We've heard your comments on how it's hard to find things, on how you'd like it to be a little bit more organized, and we have redesigned it in partnership with RQI partners and some amazing engineers in India. New product releases that address additional neonatal populations have also been developed, and those are anticipated highly. I'll talk briefly about those. Again, this is more for information for instructors, and so I'll give you a broad strokes on those. Okay, next slide, please. The instructor course. We heard you. The instructor course needed updating. So the Instructor Development Subcommittee of the Neonatal Resuscitation Program Steering Committee has spent the last 2 years redesigning the instructor course. The goal was really to develop things that are easier for you to use. So did you know you have a whole committee that's devoted to you as instructors? Well, you do. So hopefully these new updates are going to really be able to help you. The committee reviewed the existing course, developed learning objectives for new instructors that we think that all new instructors need to be able to do, and crafted adult learning questions to assure a high quality experience for instructor candidates. The adaptive learning course that came out of all this is now available online. So any instructor candidates that are new will be assigned to this new instructor course. Likewise, if they are not new candidates but have not started the course yet, they are also going to automatically be put into this new adaptive learning course. The 9th edition brings a clearer, more intuitive pathway for becoming and maintaining your NRP instructor status. So we've simplified steps and expectations. We made this adult learning course that is online, and we've made clear access to online support and updated the tools for teaching that are on there. So whether you're a new or an experienced instructor, the redesigned course content is really built to empower you to have what you need and not a lot that you don't, to deliver high quality education and get it to you when you need it. More about that soon. Next slide. So the redesigned ITK. So this is your instructor toolkit. We're going to show you the new toolbar. Next slide. These are your new tabs. The Instructor Development Subcommittee has been working hard again for the past 2 years. As I said previously, the primary purpose of our committee has been to support you as instructors, and so you can more easily find what you need when you need it. There is, as went live last year, actually a search feature. You can still type anything you want in the search feature, and it should pull up what you're looking for. Drop-downs are now grouped together with more like materials together, and we really made everything chronological from right to left, with the basics first, then digging deeper and deeper and deeper until you get to the end where you're developing your own courses. So the subjects are more chronological, the basics are first, and you're going to find out that most of the documents look pretty familiar. We didn't want to take away your familiar, well-used, and well-loved documents, but they've been all updated using new formats, there's new colors actually in NRP 9 if you look closely. So we did that on purpose. So you as instructors can, as you're going through materials that have been printed, and they might be at the bedsides, they might be in your ORs, by looking at them, you'll be able to tell if they're the old version or the new version. This makes it easier for you as instructors to say, oh, that's the old one, I'll bring you the new one. So you can tell and you can update your equipment at the bedside, your resources at the bedside as you go along. Next slide. So the content will look familiar, like I said, only it will be updated. So don't worry, your content is still there. The new templates, like I said, they look fresh. They have new colors, new fonts, new general look and feel, and so you can use this slight differences in order to update all of your content at the bedside. Existing PDFs are still PDFs. You can still print things out. So you can see the home tab. I just kind of showed some you can like barely make this out. The home screen institutional structure is really for more of you who have RQI for NRP. It has some, what's essentials, what's advanced, what's RQI for NRP. Instructor development is the next tab. And then the video tab now has the new videos. We're going to show you that in just a second. Simulation and debriefing, documents and form, and then we have some new materials. So looking at some of the new materials, we have developed a frequently asked questions tab. That is still under development, so more to come on that. But I want to really focus on the simulation bank. The simulation bank is for scenarios and ideas, and it already features Laerdal Scenario Cloud. And so those 7 scenarios that I have up on the screen. Oh, sorry, next screen. There you go. Those 7 scenarios are already up on the screen, and you can check out Laerdal Scenario Cloud. You can either download those. There is I think it's a 30-day free subscription to Laerdal Simulation Cloud if you want to check it out. More to come on that. So this NRP SCID is the NRP Steering Committee Instructor Development Subcommittee, just because there's a lot of letters there. We envision future ways for instructors to interface and share your expertise. You are the expertise that brings the training to the actionable place. So we really wanted to make this available for you. Okay, next slide. Gary, I want to actually have you talk about the videos and pictures.
Thanks, Chris. Well, a video comes up. Yeah, the 9th edition textbook features fully updated instructional material. The NRP team got a chance to travel to both Dallas and Houston, and we worked with local clinicians in their simulation center to update all the instructional photos and skills videos. These photos and video shoots were coordinated by Dr. Myra Wyckoff at Parkland in their center, and then the videos by Dr. Nathan Sundgren at Baylor at Texas Children's, and include new skills, including abdominal paracentesis, cord milking, and also pericardiocentesis. In addition, thanks to the generosity of several families in Michigan and Iowa, all of the live images of newborn infants in the textbook have been updated. The new instructional videos can be accessed using QR codes in the textbook from the main NRP website and also under the video tabs of the instructor toolkit. So have a look at all the new media. It's all updated, and it was a great experience being able to watch our team and the wonderful hosts and experts in Texas help us get all this done.
Sorry, I was talking and not having my sound on. If you look at that picture, you can see Gary in the background. He was an amazing director. Okay, new courses and new content. There has been much excitement about the expansion of neonatal resuscitation to include additional neonatal populations. Instructors need to know, this is important, learners will not be tested on these new materials. They're meant to be supplementary and educational, not necessarily an algorithmic way to manage patients. And they're optimal for learners, optional for learners. Learners are empowered to decide which offerings match their skill needs. So next slide, let's talk about some of the new course or offerings that are coming out. NRP Cardiac. This was actually released on July 3rd of this last summer. And the resuscitation in the NICU, that is coming in November, so just next month, 2025. Resuscitation in, I'm sorry, I didn't put the right thing there. I'm going to tell, I didn't on my notes. Okay, and so you don't have them in order. So sorry, I didn't update that. NEP is planned release early 2026. NEP stands for Neonatal Education for Pre-Hospital Professionals. NEP is geared toward the babies that are born outside the hospital that need to get to the hospital in a safe manner. Now, the new content for NRP Cardiac and resuscitation in the NICU are going to be all available for you in 2 ways. That there are additional book chapters, and those are a little bit like an appetizer to kind of whet your excitement to learn more. NRP Cardiac is going to be a new chapter, chapter 15 in the textbook and the ebook. And resuscitation in the NICU is actually going to be chapter 16. The book chapters, like I say, you're not going to be the learners are not going to be tested over them. They're additional material. And the online courses are going to be completely separate from the book. Next slide. So let's talk about resuscitation and stabilization of newborn infants with congenital heart disease. Chapter 15 of the book, of the new text, is the appetizer. It includes review of fetal to neonatal circulation, pre-delivery questions to ask to get ready for a delivery of a baby with a congenital heart defect, how to prepare for the birth of a newborn with CHD, what to expect for infants with select CHD, and more information on teamwork. Like I say, this is available for you now. This is actually what it looks like on your learning platform. And these subsections within the course are going to be available to you even after you finish them. And you can access them at any time for just-in-time learning or for a quick review if you need to do that. Those modules, in case you can't see them, it covers fetal to neonatal transition, hypoplastic left heart, tetralogy of Fallot, transposition of the great vessels, Epstein's anomaly, congenital complete heart block, tachydysrhythmias, including SVT, and also the undiagnosed CCHD in the delivery room. This course is online only. There's no hands-on component for this course, and the cost is only $25. So if you are interested in it, you will have access to it through your ITK. Next slide. I just have this to say anybody can enroll in it. I recommend really the advanced providers and instructors are the ones who are going to get the most out of this. And that's all your information right there. CEs are also available. Next slide. Resuscitation in the NICU, Chapter 16. Chapter 16 is the appetizer. Resuscitation in the neonatal intensive care unit includes the unique aspects of resuscitation in the NICU, common causes of clinical decompensation in the NICU, basic emergency management of arrhythmias in the NICU, considerations for CPR arrest prevention or CPR arrest prevention and post-resuscitation care in the NICU, and when to consider using pediatric resuscitation algorithms and guidelines. Again, this is only the appetizer in the book, and then the course is going to be available for you coming in November of 2025. So it is coming up. Next slide, please. And neonatal education for pre-hospital providers, or NEP. This is actually just additional information to what already exists as Chapter 13, which is deliveries outside of the delivery room. And this new e-course will be coming soon, probably available in 2026. It will include things such as not only the birth and the baby, but stabilization until you get to the hospital. So including glucose homeostasis, thermal regulation, and maintaining ventilation. So very exciting things coming up. That's what these three modules are exciting, but they are not what we came here to talk about today. So what I want to do is we have got about 10 to 15 minutes for question and answer. So I think what we want to do, let's have all the panelists come back on and let's see if we can wade through some of our questions and make sure that we address your questions as we go. So starting at the beginning, I have a question here that says, students have told me that their content already says 9th edition on their end. Wouldn't this mean that we would need to change our content now, or can we continue the 8th edition for our in-person classes? Oh, Gary, do you want to take that one? Or do you want me to take it?
Well, so I guess it seems to me this is a question about the materials that are coming online, and I have to say I'm not sure because I haven't seen that happen. But I think the intent certainly is that people can teach 8th edition courses all the way through June 2026, right? So if you're having trouble accessing 8th edition courses, at this point, I would turn that to Christy and our staff at AAP if you're struggling to access 8th edition materials. But certainly the intent is you can teach 8th edition and use 8th edition guidelines in your practice until June 1st, 2026. At that point, everybody's expected to transition over. And at that point, ideally, your institution should have made plans to transition your practice also to 2020, to 9th edition practice.
Well said. Christy, do you have, oh, thank you. No, you haven't gotten it. Can you go to the next slide? I actually had some ancillary questions here. Next one. Next one. There you go. Okay, so NRP provider, new and renewals. So NRP learners receiving, this is your instructor journey. Yeah, that's the one. Receiving a new NRP Essentials or Advanced Provider course assignment on or after October 22nd will automatically receive the new NRP 9th edition. NRP learners who have an existing course assignment that was not started before October 22nd will automatically receive the new 9th edition content. And NRP learners with an existing in progress NRP Essentials or Advanced Provider course assignment will be subject to the transition period. This is where we hand it over to you as instructors and the institutions to coordinate that smooth transition. I do want to make note, though, that starting January 31st, 2026, the NRP 8th edition e-learning content, according to the RQI website, is going to sunset. So be sure that if they've started the 8th edition learning content, they finish it before January 31st, or they will have to start over with the 9th edition content and start all over.
Chris, let me just clarify. You're talking, though, about instructor candidates. This is if you're on the instructor pathway or for just straight up NRP provider?
This is just a provider. I've got some additional slides for providers. Christy, why don't you just go to the next one? The next slide. So instructor candidates. If you start an instructor course after October 22nd, you will complete the NRP 9th edition automatically. If you are starting as an instructor candidate but haven't started the course before October 22nd, you will now be given the 9th edition course. If you started your instructor course bundle before October 22nd, you finish it in 8th edition, and then you are subject to the transition period. Okay, again, starting January 31st, the 8th edition e-learning content will sunset. So make sure you finish the online portion before the 31st, or you'll need to start over in the 9th edition. And for you all, because next slide, Christy, instructor renewals. If you are an existing instructor and you need to renew your instructor status, if you have not started yet, you are just going to automatically be assigned to the 9th edition. If you've already started it and you've already started the online portion in the 8th edition, you're going to need to finish that before January 31st. Everything else is intact. Everything else is the same as it used to be. Okay, was that clear? Do you think, Bobby and Gary?
Yes. It's a little bit confusing because although we're saying that you have until June 1st of 2026 to completely change as an instructor your course to the transition to the 9th edition materials, some of those materials are already being updated online, and so your learners will have access to those. And so it is a little bit confusing, I think. Chris, you might want to just address that in a little bit more detail.
Every institution has total control over when their institution will transition. We recommend that everybody by June 1st, 2026 is transitioned over to the 9th edition. Within each of your systems, you will need to coordinate the instruction. So this is just what will be available on the websites that is being hosted by RQI.
Chris, I noticed Julie and a couple of others, Julie Moon, a couple of others have mentioned that current students are getting 9th edition online, but they haven't received their 9th edition materials yet, and neither have instructors. So she comments that they are confused, and we probably need to make this a little more clear because
Yeah, I agree. So the book will not be available in the textbook. The in-person textbook will start shipping in November. You can get your 9th edition material online as an ebook form right now. Each course, and I may have to defer this to the AAP staff to see how they're putting it out for each of the institutions. But everybody who buys a provider renewal or newer renewal will get access to this ebook. What that looks like for your institution may depend contractually. So I don't know what everybody's contracts look like, but that's what you are entitled to for signing up for the new version. All right. Question of will we receive a slide deck in order to update our current slides when teaching NRP? I'm not sure what slide deck you're teaching off of, but you can, this slide deck will be posted online on the ITK. How do you recommend? No, go ahead.
I was saying also the science in service may help for your learners, and the practice change table that's on the ITK also may be helpful. So a number of materials to help guide that transition from 8th to 9th edition changes.
Good.
Chris, I know I saw a question in the chat or in the Q&A regarding when will I switch over? Can you give me recommendations for when I switch over from NRP to PALS? And I do think that some people might be disappointed to hear that I'm not going to tell you that at 1 week or 30 days or anything like that. We are not going to make those recommendations, but that the new chapter in the textbook and those ancillary materials really are very thoughtful in their approach to how we might use either NRP or PALS in the NICU. And so I really encourage you to take a look at that chapter specifically. Gary, do you have anything else to add to that?
Yeah, we have tried to address that, and that's again what the new lesson 16, resuscitation in the NICU is really about. That it's about that transition, and I think that it will come down to institutions a little bit depending on what type of NICU you run, what type of nursery you have, what type of babies maybe even come through your emergency department, who the staff are, because there's lots of questions even involving how you train your all of your staff, your respiratory therapists, your nurses, other things. One question to ask is why would I want to change from NRP to PALS? What type of patients do I see? In general, I think the question you should ask typically is not a particular age, because there's really no number of days, post-conceptual days, when the pediatric guidelines are most appropriate. In general, it's probably most appropriate to ask about the pathophysiology. So if a baby has a respiratory arrest, and nearly all infants in our NICUs, even older infants in our NICUs, they have respiratory arrests. And in that case, using the principles of NRP is very helpful. Remember that the pediatric algorithm, if you look at it, really isn't very much different from the neonatal algorithm. The one that is different is if children have pulseless VTAC, VFib, or a cardiac arrest, asystole. And in those cases, the pediatric guideline starts with compressions. If a child has bradycardia, which most infants in the NICU have bradycardia as a result of a respiratory arrest, they don't have VFib, they don't have pulseless VTAC, they're not asystolic, then the pediatric guidelines also start with ventilation. And so there's really very little that's different. If you have a unit where you have a lot of primary cardiac arrhythmias, VFib, VTAC, asystole, if you have a unit where you'll see intoxications, if you have a unit where children who were in the emergency department but they're under a month of age and they've had an intoxication, electrocution, trauma, in that case, PALS may be the program that's most appropriate for you. In my own NICU, of course, our staff attends deliveries, and the babies in our NICU, although we have lots of babies that have had cardiac surgery, even still when they have a problem, it's almost always respiratory and it's bradycardia. And whether you follow the pediatric or NRP guideline, it's going to be essentially the same. So look at your unit, read the chapter, the new one, 16, look at the, we also address this in the special considerations chapter, but there's no single answer. It takes some real thought about how you're going to train your unit and how you'll approach it. So that's a long answer to a short question.
Complicated question, Gary, one that
It is
we've been
complicated.
wrestling with for a long time. So appreciate that question and your answer.
Here's another question. How do you recommend we teach to laryngeal mask placement for ventilation initiation? Is it reasonable to say if you are starting ventilation, use an LMA?
We now have evidence that a laryngeal mask is as effective as face mask and maybe more effective. The nice systematic review that was completed by Nicole Yamada for ILCOR just a couple years ago showed that if you use a laryngeal mask as your primary device, it may decrease the likelihood of moving on to chest compressions or intubation or chest compressions. And so some places may choose to use a laryngeal mask as your primary device, and that is entirely reasonable. And 9th edition NRP is supportive of that. And the consensus on science from ILCOR, as well as the American Heart Association AAP guidelines, are supportive of that choice. I'm not sure how many places will choose to use a laryngeal mask as their first device. I think many will continue to use a face mask. But if you're a unit that has that prefers to use a laryngeal mask as your very first device, it is entirely reasonable and fully supported by current guidelines.
I'm seeing a lot of procedural questions as far as the transition for classes and for November classes. I'm actually not sure about the contractual arrangement with each of the parties. I've just told you what's available online. So I may have to defer to the AAP staff. I'm seeing a lot of questions about this. And so we may have to just defer, and if you have questions, we may have to answer those questions individually to see what you do for November courses if the 9th edition is not yet available. What is available online is, as of this moment, 9th edition. So this is, like I say, this is the biggest release, the simultaneous release that I have seen in my career. And with everything from BLS and PALS and ACLS and NRP all being released on the same date, everything just kind of pushed through. So I apologize for any confusion in the meantime, but we may need to work with you individually on that.
I do think I would be reassuring of instructors, though, that as Gary pointed out in his presentation, there aren't many significant changes in the algorithm. There are some, and they're important, and we want everyone to look at those. But I do think that there's not going to be a lot of, there won't be a lot of changes, Gary, to for people to have to worry significantly about in the two versions.
Yeah, but it does seem, Bobby and Chris, with the number of questions, and it sounds like we're actually not completely sure of what experience the instructors have been facing since the release date on October 22nd. We'll connect with AAP staff and then make sure these things are all clarified in answers after the webinar is over, and make sure it's easily accessible.
In fact, I just got clarification that this answer will be sent out to all instructors. So we can move on from this particular question right now, and but we promise this is coming out from the NRP and the AAP shortly to you.
That's great.
Your AAP team is listening and they're responding as we speak. So hold tight. Next question: will there be an additional charge for the NICU resuscitation modules?
So the NICU resuscitation course is a separate course. They're not modules. It is a separate course. It is an additional course. And yes, there's a separate fee for the NICU resuscitation course. The supplementary materials in lesson 16 are available to everybody. And so that's just part of the textbook. And again, it's not tested. If you do want to take the entire course, and the NICU resuscitation course will also include a hands-on component. That's been piloted now a couple of times, and those who are attending some of the fall conferences, you may have had a chance to participate in a pilot. But the full course does involve an extra fee. On the other hand, the some of the material that's included in the course is in lesson 16 and is available for everybody.
Here's a really good question. Terminology. We didn't really talk about this today. We talked about it some yesterday. Terminology used is a little bit sometimes confusing and not matching the knowledge. So can we explain why we would use the word infant, the word newly born, and the word newborn? Also, I would want to maybe add why we use deferred cord clamping now and maybe any other terminology changes.
It's a great question. One of the things we've noticed, even at the ILCOR level, at the international level, is the wide variation in terms that were being used for similar or slightly different concepts, and terminology was becoming quite a concern. And so, with ninth edition, we've made a concerted effort to simplify terminology a little bit. And so, you'll see throughout the textbook in ninth edition. Babies in the delivery room are referred to as newborn infants, oftentimes at the very beginning of a paragraph, and then you may see it simplified to infant throughout the rest of the paragraph if it's becoming very repetitive. But we've generally moved to the term newborn infant. There's also been a change in terminology. The abbreviation PPV is no longer used. PPV stood for positive pressure ventilation. And since, of course, we never use negative pressure ventilation in the delivery room, we've shortened that to just ventilation or assisted ventilation. And that's also consistent with now all American Heart Association guidelines use the terminology ventilation or assisted ventilation. You will also see some more inclusive language throughout the textbook. And so you may notice that that we use the term pregnant person, and so there have been some changes to terminology, and over time, I think you'll see as ILCOR also changes, you may see some changes to the way we describe intubation, and so not with the ninth edition, but coming up down the road, you may start to see some changes in terminology used in neonatal resuscitation, and it reflects an evolving understanding of making the terminology both simplified and a little bit more clear.
And I think I would advise people to stay tuned for things. There's a lot of work going on right now with these terminology. For example, the cord clamping management. There's lots of work going on right now to try to help us define these terms better. And so as you watch the literature in the next couple of months and next year or so, I think you're going to see a lot more about this coming up.
Yeah, and you did mention also deferred versus delayed cord clamping. There's a little bit of a negative connotation to saying you were delayed. It sounds like you didn't do something you were supposed to do. And so now that we really do recommend in babies that don't require immediate resuscitation, we recommend not clamping the cord for at least 60 seconds. So then rather than using the term delay, you'll see throughout ILCOR and American Heart, the term deferred is being used so that you don't have that negative statement that you delayed it. It was intentionally done. It wasn't an accident. You intentionally deferred cord clamping for at least 60 seconds in babies that don't require immediate resuscitation. So yeah, there's a little transition in language this time.
Here's a comment from an instructor that's encouraging. We have taught blended learners this week with half having done the 8th edition and half the 9th edition. It was not that distressful. I just reviewed the 9th edition to the group, and we followed our 8th edition algorithm posters for the team lead checkoff. We discussed the changes at each step during the skill steps. Perfect. That's exactly what you need to do. Just continue teaching as your institution is deemed teaching needs to happen until their transition happens. But discussing the new changes during your course is absolutely perfect.
Yeah. Kristen Roberts asked a really nice question about the change in the way we present the Mr. SOPA steps, so the ventilation corrective steps. She mentioned that 9th edition says you can choose the steps that are most likely to be helpful and prioritize the order in which you perform them. And that could be difficult with certain teams and learners. And certainly as an instructor, you are free to continue to teach the series of Mr. SOPA the way it was. We did want to make sure that more experienced and expert resuscitators had the opportunity, if they want to change the order as they need to. There was a sense before that you must follow that order. And we had a lot of feedback that at times, if you appeared to have a really good seal on your mask because you were reaching your pressures on your T-piece or your manometer, why would I ask you to remove the mask and replace it when you had a good seal? And it was a good point. And similarly, at times, if all you need to do is to reposition the head because you believe you have an obstruction, why would I ask you to remove a mask that you've placed correctly? So taking that feedback into account, we felt this time we've been doing the ventilation corrective steps now. There's some research from Children's Hospital of Philadelphia that shows not all the steps always need to be performed, and some may actually at times cause you more trouble than good. So we did want to give both instructors and providers the opportunity to use your judgment which steps. But if it's important with your learners to teach the order in the way it's presented, there's nothing wrong with doing that, but you're not required to.
And I think especially for more junior or novice learners who are new to NRP, having that mnemonic, Mr. Sopa, might jog their their thinking during resuscitation. Whereas someone like Gary, who's been doing this for a long time, he might, like you said, he sees good chest wall rise. He feels his seal is really quite good. But then all of a sudden he gets to thinking about turning up pressure, but then the baby has significant secretions. And so Gary is going to suction then instead of, going up on pressure. So I think it's okay to continue to teach Mr. Sopa, especially to novice learners who need to understand that there are multiple different areas that we can troubleshoot when it comes to ventilation, but then giving people who with a little more experience the ability to, you don't have to follow that so strictly is perfect, Gary. Thank you.
Another question, the AHA BLS updated compression technique for newborns to use the heel of the hand. Is this being adopted for NRP as well?
No, not at all. NRP and the best evidence we have for chest compressions for neonates is the two-thumb technique. And again, we do recommend, as soon as you have an advanced airway or an alternative airway in place, chest compressions from the head of the bed. That's been shown to improve both the ergonomics and the compression depth. And so two thumbs, a line just below the nipples, but make sure you're above the xiphoid, a third of the AP diameter of the chest, which is deep. It's freakishly deep. But two thumbs, not the heel of the hand, not for neonates.
Any change in the cardiac monitoring?
I'm not sure exactly what you mean by cardiac monitoring. We're still recommending, again, that at the point you get to intubate, you should place an ECG monitor. There is, again, this concern that some babies may have an electrical rhythm, but their heart is not pumping. That's a problem called PEA, or pulseless electrical activity. We believe it's likely, it's unlikely. There aren't very many babies who are going to have an electrical rhythm above 60 beats per minute where it would change what you're doing, but no contractions. So the heart's not pumping. However, it is possible, and so you do have to use all of your tools to try to assess whether or not you are seeing PEA. And so if you see a baby who has a heart rate that you think they ought to be doing well, yet you feel no pulse, your pulse oximeter doesn't show any signal, you listen with a stethoscope and you hear nothing, then you still have to be cautious, and you may need to continue compressions. And this is discussed a little bit more, again, in the NICU resuscitation chapter, where a problem like PEA is more likely to happen, and especially in the setting of cardiac tamponade. And so this is discussed a little bit more in the NICU resuscitation chapter, but it's a good question. But we still do recommend ECG monitoring at the point that you go to intubate, and certainly ECG monitoring when you're doing chest compressions. So no significant changes I can think of.
And Chris, I've had a chance to really quickly get some more information on two questions that we previously answered. One is there an extra cost for the separate courses for the NICU course and for the cardiac course? And as Gary mentioned, yes, and that cost will be $25 for each. Again, as Gary said, the basics, some of the information, the basic information from those 2 courses will be included in the chapters in the NRP textbook, which are free to anyone who has access to the NRP textbook. But the full courses, including the hands-on portion that Gary mentioned, will be $25 a piece for those. The second thing that I got a little more clarification on is that pediatric basic life support is still encouraging 2 thumbs encircling the child unless you can't fit your hands around the child, and then is the heel of 1 hand. So that is just in pediatric basic life support, not in neonatal life support.
Here's a question about, and I'm watching our time actually. We are not going to get through all of our questions. So whatever questions we are not able to get through, we will answer them in Word format and put them on the ITK so everybody will have access to them. I think we're probably going to need to wrap up. One of the AAP staff can text us and just let us know we need to wrap up right now. And I want to just make sure that you all know that you'll be able to access whatever questions that we have not been able to get to. This is, there's a lot of questions. A lot of them are procedural, and any of the transitions between versions always are just, there's a lot of questions that come up on an individual basis. So we're broad stroking today, and we may need to get a little bit more information to people on more individual questions, depending on contracts, depending on individual circumstances. I am getting note to wrap up. I want to thank everybody for joining us today and for coming in and giving us your attention, and we really appreciate it. I do want to thank you all for joining us, and we thank you for all your dedication to neonatal resuscitation and for the work you do every day. The work that you are doing and how we support you matters, and please keep in touch. If you have any of these questions, look at the ITK in the next couple of days. We will try and get the answers out as soon as we can, and don't hesitate to reach out. Closing remarks, Gary, Bobby?
Just thank the 2 of you and all the AAP staff again for the incredibly dedicated and tremendous effort and hard work you put into the 9th edition. We will get all these questions answered, and the AAP staff is working on it literally as we speak. Thanks, everybody.
Yeah, thank you. Have a wonderful afternoon.
So I see we're no longer recording, and I'm assuming that means we're no longer.
Gracias por la invitación.
¿Contento?
Sí, contento y también con un gran sentido de responsabilidad, ¿no? O sea, siempre recuerdo esa frase, la frase más importante de los cómics, ¿no? Que es cuando el tío de Peter Parker es
Sí.
el hombre araña, ¿no?
Sí.
Y va intuyendo, ¿no? Y entonces le dice, con más poder viene más responsabilidad, ¿no?
Totalmente.
Entonces, acá yo creo que se le ha dado al presidente Milei y al gobierno, digamos, un respaldo que, bueno, me parece que es un empoderamiento, pero que del lado nuestro